if you're not ready for the sensitive nature of this video, just stop it now and don't watch it. Okay? It's about supplement. I made a video recently on prostate health and the role of sex in preventing prostate cancer. And at a point I talked about supplement, but then what is available in the medical field, what is allowed to be spoken about it was what I did. But this one, I want to make sure that I communicate something very, very important, but at the same time it's very, very sensitive. If you have not watched the video, go and watch the video. It's about prostate, health. Prostate. We discussed prostate cancer, prostatitis, that's prostate infection. We also discussed about enlarged prostate, the management from A to Z and everything. And I touched on the part of supplements briefly. But this video, in order not to complicate that video, I made sure that I did not, expatiate on what I'm going to be talking about right now. Okay? Right from time, supplements are frowned out by the entire medical community, especially the orthodox medicine. You don't bring supplement because we believe that it has done more harm to people than good, and that has been my position. But I also want to mention at the same time that I've had experiences of some very, very good supplements that if it were not for them, I would say these people wouldn't have survived, and there are a lot of things anyway, so that's why I say this is very, very sensitive. Do not take me by whatever I'm going to say. You go and do your research, because I'm not giving you a go ahead to begin to use supplements. There are circumstances where you may want to accommodate that. You want to accommodate that kind of practice. First and foremost, you have to be doing that with the knowledge of your doctor, and you have to be monitored, and it has to be in addition to whatever medicine you are taking. I remember a patient who was being prepared for surgery, for breast cancer surgery. Of course, among all the patients of the hospital as at that time that did the surgery, she was the only person that had a very impressive outcome that the doctors were wondering why, because there were some supplements also introduced to her. In fact, because of this supplement, she was contemplating not doing that surgery. And I said, no, you just have to go ahead and do the surgery. She came visiting me and I examined the breast, and what I found to me was like, be careful, I can feel some. But to her, doctor, if you had seen where I started from and after the supplement where we are, I think I can rely on the supplements and not have to do the surgery. But I said, madam, please go ahead and do this surgery. And she was happy for that. She went for the surgery. After the surgery, her health was like, whoa, like, am I going to survive this? It was, breasts, when you remove your breast, that hand, that part of the limb is in trouble. Serious collection, swelling and everything. So she started the supplements again, and wow, it's like nothing happened to her. She recovered. Her blood level that kept being low, came up. So I'm telling you, supplement is not a replacement for surgeries. Is not. So that's why I say this video is a very, very sensitive one, and I'm advising you at the moment now that please relate with your doctor and let's get monitored. Supplements are safe. They're not going to make the cancer or the condition worse, not likely, except you decide to abandon everything and go. And let me also tell you that not all supplements are reliable. Like for me now, I think if you bring a list of 100 supplements or 1,000 supplements, I may just pick like 3 that I can trust. I say, no, these 3, the rest I can't trust them. You understand? Whereas all the rest would have been patronized. So they are good for the same thing, they are good for that. So that's how delicate and difficult that supplement area is. Okay, and those of my patients who have passed through me and had that experience and are watching this video, definitely they will know what I'm talking about. So please note that this that I'm telling you is very, very sensitive. The very, very sensitive area is even a criminal thing in the medical field to be seen to introduce supplements to somebody who has prostate enlargement, prostate cancer and all that, and they are abandoning their regular treatment. No, at least let us create this awareness. There's also the fact that doctors have not taken time to, not just doctors, scientists world over. I don't know if it is a game plan or it's a conspiracy theory. They have done all the research to study how people are using supplements, how they are abandoning supplements, they are abandoning orthodox medical practice for supplements, and they are doing all what's not, and they are studying that very well, but they've not really taken time to study which of these supplements are actually working, which of them are reliable. So I would encourage the medical field. Like for me, I practice pure orthodox medicine, but where I see someone may benefit from supplements, I introduce it and I put that person on and kind of alert. We keep testing, we keep checking, and even when it appears things have resolved, we don't just stop at that. We still go ahead. So if you are listening to me and Dr. Austin, I love people to be healthy. I love people to be fine. I like to treat people, and the treatment is permanent, and that's why I am forced. My conscience is pushing me to do this, and that's why I'm doing it. So know the clauses there. This is not a license to start trusting supplements. No, it's not a license. But wherever you're going to do it, relate with your doctor. Let him monitor you very well. Let him know what you are taking. Unfortunately, many doctors will not even allow you. They will not approve of that. But for those who will approve of that, who is okay, no problem. I think with this video, if you can share this video with probably a doctor that you want to work with and all that, you may say, okay, no problem, let's give it a trial. And if it works, definitely you'll be helping a lot of other people, because that doctor will definitely start using it for other people. I know a woman who had kidney problem, and everything that was done wasn't working for her. Eventually, she was being planned for transplant, kidney transplant. And according to her, this supplement was introduced to her. And when she started it, she recovered. They looked for a kidney problem they couldn't see. And the doctor that was managing her, that was planning her for kidney transplant, got to know about this. And since then, he started using these supplements, to treat other patients. So we can as well help other people. I know some of you know the video I'm referring to. The story is a testimony. If you want to see this testimony, subscribe to my channel and check the videos there. You will find it there. If you want me to repost it, I'll repost it. So I'm just keeping it real with you. Do have a lovely evening and enjoy yourself. I want you to stay healthy. I want you to be alive and well. The trouble in Nigeria is just too much. Yes. We just have to find a way of giving life to ourselves and making ourselves happy. Yes, supplements are expensive. God will provide the money. That's the reason why you really need to work hard and don't lazy and pray for a better government so that things can be better for us. Do have a wonderful evening. Bye.